loud.
I went out and I saw.
I could tell when you're bored.
No, I wasn't bored, but anyway.
Yeah.
What are we talking about?
Other word, preventatory awareness.
Yeah, so we can talk about this, do the massage. I taught the wife how I was telling, talking, I was only in the park, so normally I would have thrown out diagrams, my diagrams.
Massage makes more sense for our women here than saying have sex. Because it's like,
They were saying so far.
I mean, you're comfortable with you, so
They're
they know
comfortable with
you. Couldn't throw that out there and be like,
I doubt it. I think they would accept
a friend that, yeah. She asked me how can she get her period going. I was like, well, have sex and then get your period coming early rather than trying to. She disowned me. Saying that, I got in trouble. Yep.
Wow, you're gonna be a great midwife.
I know. I know. Get that contraction going. Get your uterus to contract and you get your period early. You can go on your trip. It's just like, oh, maybe hot foods. Yeah, eat your hot foods.
That's what I just said.
Just the watermelon. I said eating food. I'm like, good luck. Eat a watermelon, get your period early. One day.
This is like you can only get pregnant if the woman has an orgasm.
Exactly.
Oh, okay. So, but what I want to, couple of things. I know it's in the middle of the newborn thing.
Yeah, we're talking about pelvimetry.
The pelvimetry, we
Awareness.
will get into that. I was just telling you about the park conversation. So that I was very surprised, but it does mean that we can teach people. I was so surprised that she was willing to learn
Yeah,
perineal massage and that he was willing to perform it on her.
because they
You
would do
know?
massages.
Well, yeah, but these guys,
No,
they
they're
don't
fine
even
with
see their women after having 7 kids.
they're fine
They
with
don't
that.
know.
They're fine with that.
Yeah, but so this was cool. This is cool. Okay, so I was talking about the baby. I still think I'm on Apgar, the color. I know one thing I was heading into the color yellow. So you can have a baby who is pink, perfect. Often you will have a baby with blue or white hands, no problem. You may see blue on the top of his head, that's okay. In terms of color, yellow. If a baby is born yellow, he's born with jaundice, which means he's already in trouble. We can deal with that, but it's something you look at, it's something you analyze and check out. If you have a baby that's all white and is cold to the touch, so this is part of what you're looking at. Temperatures in there. Oh, God. Anyway. Looking at the head, again, appearance. This baby that we saw had caput. Nice swelling here. Sometimes you can have a swelling on this side or on this side or over here, depending on which bit got stuck. These are all fine. The only time you want to pay attention to something is if you have a kefa hematoma. So bones are actually layers. They're not just solid rock. They come in different layers and there's blood circulating within the layers. So sometimes there can be enough trauma to the baby's head that the baby will hemorrhage into the skull plate, into the bone. You can determine this different from caput swelling because they stop on the line. It does not, the swelling or the hematoma does not cross the baby's sutures. Yeah. So they just stay here. Again, this can be fine. You want to watch it. It should decrease within 4 or 5 days, be gone. You sure as hell don't want to find it growing. You may, this is a discussion. Krista, you mentioned, asked me about showing equipment. Always, always. One of my classes is sitting down with the parents and opening my birth kit and going through every single tool. Even if I don't, just telling them what it's there for and why it's there. And how many times I've actually used it, which sometimes can be never. It's just there in case.
So good. I can see how that could like relax a mother a lot, a parent.
Absolutely. So this is what I see
That's
more.
what they want to see.
This is what I see, that this is what they want to see. They want to be having their babies at home, but they want you to be able to help, be prepared. Again, I'm a woman who had 5 children at home. I attended hundreds of births, maybe close to 1,000 births by the time I'm having my youngest. I always had someone with me. To me, it was another pair of hands who knew what was going to do, what was going to go on. Otherwise, I was going to have to instruct my husband and my kids, and I really don't want to go there. You know what I mean? Fuck, I have to become a diplomat and get my children who never do a goddamn thing I tell them to do. I go for a cesarean, man. I'd rather have a cesarean. I swear. I'm pissed off at them now at the moment, actually. Oh. Anyway, it's okay.
Yeah, so you show them your birth kit.
So I do show them the birth kit and all the tools and what they're there for. I actually have had I've only done very little free birth training. And I just sit there, they ask me questions and I answer it for them. I go through anything that I think, my experience at free birthing is the biggest issue is they're worried. So when the contractions keep going and going and going, there is a point where they can become fearful or concerned, and they just want you to say it's okay. It's okay. And I tell them this, that mostly that's my experience, and that if they don't come to accept that it's okay, they transfer. And most transfers were unnecessary. It's just that they didn't get the reassurance that everything was okay. Yeah, me too. So yeah, I agree. In my experience, free birthers are strong and they're tough and they take responsibility and accountability. So no problem. I don't have them. I'm ready for them, but I don't have them. I have the other kind who want me to carry stuff and be ready for them should something happen. And for me, I need another pair of hands to help me. Our color, appearance. So you will get babies covered in vernix. That may tell you that the baby's early. And again, I want to see the other Apgar scores. Is he breathing? Then I don't care about the vernix. It might just help me analyze and determine how long the baby gestated for by the time he was born. Next one, no vernix, not even in the creases. And so again, I'll try to find it. If Kalindi, any Australian out there, Kalindi, you have that paper, you did not give it to me, the card. I'll see if I can find it. It's just a sheet of stick figures. And they're helping you, the stick figures help you determine the gestational age of the newborn, which can be done later. But one of the things you're looking at is the vernix. But the vernix is not life-threatening. It's just information. Respirations. Feel the pulse in the cord. Put your hand on the baby's chest. Actually, I skipped to the last one, respirations. Reflex, that's it. Reflexes. So pulse and you're feeling the pulse. See, I take things off. So I could easily look at the baby and minus, 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 or I'll give him 1. I won't give him 2. I won't give him any. So I'm paying attention to the pulse. I'm paying it by putting my hand on him. Of course, I'm aware of what's happening with the umbilical cord, but there's going to be a point where that cord stops pulsating, and I want him to start taking over. I haven't seen them go for very, very long. The cords. Any reflex, any grimace is a good thing. Limp arms and legs, head that falls back like that baby, not good signs. I'll tolerate it 1 minute. I won't tolerate it 5. I want to see something. Yeah.
So pulse, you check the umbilical cord?
Well, pulse, that's one thing. No, you check the pulse here.
Okay.
Yeah, you're feeling this. You can also reach in here and get the femoral pulse. Yeah.
What should it sound like or feel
Like
like?
it feels like a pulse.
Okay.
Yeah, like a pulse. It should be a nice strong one. So another thing, if you find that the blues are complete, the legs are completely blue and start draining of color, yet this is moving around, check for a femoral pulse. Make sure that there's been no damage or blockage.
Okay.
That would indicate there's something's happening. There's no oxygen getting to the lower limbs.
So in my score here, I have appearance, pulse, grimaces, activity, and respiration.
Reflexes.
Reflexes.
I think the respiration kind of goes in the pulse. Check it up and see. Oh, you looked it up, did you? Okay. Then, so what the grimace goes under the reflexes will go in grimace?
I would think grimace would go under.
Well, grimace is a reflex. That's what they're trying to see, some sort of temp. But reflex is all, okay, so not straight away.
Okay. And reflexes will be the sock reflex, the tonic neck reflex,
This is for the Apgar?
yeah.
Okay, yeah.
Yeah. What is rooted reflex? That's going for the reflex.
Breast,
The
where they go like
reflex,
this.
Baby's mouth is throat untouched. Okay.
Routine. Yeah, exactly. That's a full, I mean, they're really born with that. That if you rub here, they just
Yeah.
rub here. Yeah, it's just a reflex. And they'll want to stuff the next thing that comes in their mouth. Yeah, the nose, it's so cute when they suck on your nose, isn't it? And they suck hard too. I love it. So Lord. All right, so.
So reflex is there.
Reflex is there. So some of the things that you're looking at straight away at birth, of course, you want these things to be looking good. If you're going to respond to it, there's specific issues that relate to circulation, which is partly what you're looking at. So when you look at this baby, you're seeing whether or not it's circulating nicely, the blood is circulating. If it's not, you'll see something funny on the baby to indicate where there's the problem.
So you were talking, sorry, I cut you up there a little bit. You were talking about the characteristics of a baby. What you mean is the color, heart rate, reflexes, muscle tone, and respiration.
Yeah, yep.
These are all characteristics. But then there's in Apgar.
Apgar, stick to the Apgar. It should be the Apgar, not what I'm doing.
Okay.
I've become natural, so I've actually forgotten I'm saying anymore.
Beyond this, then you should be like, okay, these are the things to look out.
Correct, exactly,
Yeah.
exactly right. So do learn the apgar. It is important. It is how you, this is what you look at a baby and decide, is this baby okay? Does this baby need attention?
Yeah.
And indeed, you can stand back for a bit, but there's a bit where you're gonna go. Now, okay, I'm gonna give some attention. Now, one thing to pay attention to, again, I can't stress it enough. You guys need to understand anatomy and physiology. So it's very important to understand that brain cells die very quickly
Yeah.
and rapidly, and they don't come back.
Yeah.
So you can have disabled children from not being resuscitated properly. Yeah. And I do know a few, not from me, I just happen to be related to them. And we're seeing more and more.
Is it like physical disability, intellectual, motor, like what exactly did I see?
More mental, catching up, more, not physical, not physical, just a little slower. And these are the ones who struggled to breathe. Now, having said that, Mandakini did not breathe for 10 minutes, more than 10. Yeah, Mandakini, who I'm particularly angry at right now.
But she ended up okay, for the most part.
No, she's horrible.
Okay.
All right, she's a professor.
Professor, what?
Child education. She's a special ed teacher.
Oh, special aid
She
teacher.
does like behavior now.
She works with babies, with kids with disabilities, not. Oh, right, yeah. She created certain teaching programs in Hawaii, state of Hawaii. Yeah. I just don't like their mother there.
We can talk about it.
No, we don't get angry and have to rip this kid's head off. All right.
I hope it's Mandakini.
Understanding. So she didn't breathe for 10 minutes. We did not use oxygen. Manindra did start doing something. She started pumping her and talking to her and praying and telling Krishna she would never do another birth again as long as Mandakini is. Man, when you're dealing with this, you can look cool and calm, and I had no idea. I mean, I was cool and calm. No, she was in her mind. It was in her mind. She told me later. And yeah, I remember thinking the same thing at number 5 or not 5.
Yeah.
I was going, oh shit, I remembered what she was thinking, her prayer, and it just hit me too, but I can't say that prayer. I can't make that prayer. So I just had to do it anyway. So Mandakini was fine after X amount of hours. Some people not so. Another issue, it's very important to study maternal shock. After maternal shock, you're at risk after you lose enough blood that you go into the type of shock that number 5 went into. You can have health issues that continue to torment you for the next 6 months and have every chance of affecting you for the rest of your life. In particular, your kidney and liver. If you lose enough hemoglobin, they become permanently compromised. So these are why these things are carried. I am not saying to carry them. I didn't carry everything all the time. Now I can, yeah. Now I can. I never did. I didn't carry a lot of the stuff I have now.
Like what? Do you have now that you didn't used to have? Just curious.
I always carried the IV hook setups, but I never used them.
Okay.
And of course the catheters I never used until here. Oxygen I used. Heavy suction I never used the suction on, my oxygen, you can switch over to suction. A Bacanaz, and I never used the suction side of the machine. I've only ever used the bulb syringe. we mentioned briefly, it's not the baby, but we mentioned an episiotomy. And there is only one woman I wish I had cut an episiotomy. And she's the one who said right afterwards, and I checked her, that she had a 3rd-degree tear, which means she tore through her anal sphincter as well as her vaginal sphincter. And as soon as I checked, yep, it's a 3rd-degree tear. You're gonna have to go to the hospital for this one. And she just looked at her friend and said, I told you I was gonna tear through my asshole. And she's like this. She has a strong mind. She's had all her babies at home, but she has a strong mind. She's confident. But we're not perfect. This is what I'm saying. None of us are perfect warriors. I'm probably look as strong as amongst women than you've seen, right? Like how many times do I crumple into tears? I'm so flawed. Anyway, you just have to get over your shit and do it anyway. So, shoot, what was
Physiology, 30%.
So this woman, didn't I tell you? And certainly what I noticed, she's stretching, and you can see where they're going to tear. It gets very white. And you can see there's going to be a white line, and her white line was here. And I could just see it starts here, and then it gets longer and longer, and then this whole area goes white. I got hot compresses against the head, against her perineum. I got the oil and I'm massaging. I remember looking at the lady. Hair, and sure enough, I could feel it tear right under my hand. And it was a nasty tear. So she did talk herself into it. She talked herself into a couple of other things that she continued to talk herself into every other birth, but not the tear. I talked her out of that one. So she stopped tearing.
Like, what is there issues in the long term if you have such a like big tear?
It can be. Now, tears are always better than cuts. Tears heal much better, much stronger, and the fabric knits together better. This is why I talk about clay work, ceramic work. You score it, you put it together, it heals together better and tighter, much tighter. Now the clean cuts, oh my God, they're beautiful to stitch. They are so easy. They're just so easy. But a jagged tear you have to think about. So it's harder for me to stitch it, but it heals a whole lot better. Now, in India, as a routine, you walk in that door, you will get a side episiotomy. They cut here, and then some of them will continue a cut this way, right? So it's a check. It's off to the side because they're afraid if they cut you straight down that you're going to continue to tear. You will a little, just don't cut it so big, or hey, don't cut it at all. You cut to the side.
Get a muscle.
This is every time you cut muscle. If you tear, you have every likelihood of tearing over the top of the muscle. You can see the muscle. You just either you don't stitch it at all and it comes together, or if you stitch it, you don't have to bother with the muscle. Leave it alone. Or, so don't cut. If you cut this way, the reason why they cut this way is so it won't keep tearing. And that for the same argument, they cut a check, a tick. That is the most painful tear. It is the hardest to regain integrity of your tissues and your muscles. You are very likely to continue to tear there every time. This is called morbidity. So there's 100% morbidity in India. 100%. What woman gets out of a hospital without some damage, permanent damage? So she's the only one I wish I had cut.
that
Yeah.
a tear is better than a cut,
correct?
because a tear you can sew back. It's cleaner. No, it's jagged.
It's harder to stitch, but it heals better. I'm gonna do those classes, on Saturday. I'm bringing out these blocks of clay. So you watch, I'll show you how to do it. When you'll understand what it is and you put it together. I'm gonna give you two types. You score one, don't score the other. Put it together, see which one comes together better. And this is part of your body. This is part of understanding anatomy. Yeah, the planet teaches you all of this. It's out there. It's out there. You know? Yeah, the planet's a great teacher.
It is, that's why I'm here.
Oh, yeah. So, okay, a little bit more, because I keep thinking about it. One of the some of the appearance, when you fill in my chart, you'll see there's a labor and postnatal report, newborn report. So they say appearance. You don't just say, okay, are good. You need to answer the questions. Baby's color is good, or clarify. Tone is good. Okay, what does that mean? You know, he's fist, grasping, brooding, blah, blah, blah. You do want to look at the baby's spine. You take one look and his bum. You want to see, I'll run my fingers down it, but I'm also looking for marks along the spine. In particular, I don't want to see pimples. I don't want to see, I sure as hell don't want to see this. Not nice. Spinal bifida. And I did have one baby with spinal bifida, but it was really small. But she was breech, and they named her Krishna. And they weren't devotees. They weren't devotees, but they named her Krishna. So that needs to be addressed immediately. And as I said, I was showing you these cards before. And they're referring to metabolic and genetic seizures and metabolic disorders that you see at birth. Is a baby having a seizure? Transport. Genetic defects such as spinal bifida. But I'll take a picture of these and send them to you. Down syndrome is not urgent, but by looking over the baby, and a lot of the tick list that you're looking on is trying to recognize some of the various trisomies, which Down syndrome is a trisomy. Which is a genetic mutation. There's special ways to transport a baby. We will do that another day. Visible defects and problems. Exposed organs and defects. Yes, you can have various organs expose themselves. Sometimes a lot of the things won't necessarily be picked up at birth, but be discovered in the days following. Especially, these are some of the things you ask the mother to look for. A brain exposed. Yeah, you want to transfer. But there is a way to transport. Sepsis. That's part of what you're looking at if the baby is born with jaundice and fever. Yep. Do these? Yep. I'll take a picture and send them to you, but they are great to have.
Yes, I like this.
Yeah, I think I'd like to recreate them. And again, read them every month if you're going to births.
Yeah. How about scoliosis? Will you tell them, but the newborn have that, or is that something you get when you get?
Some can be born with this. Again, that's why you're running your fingers down the back. Indeed, you're running your fingers down either side of the spine, and you want to see if something goes like that.
Okay.
Kanani, my oldest has spina bifida. And she has a concave chest and a heart murmur and a prolapse.
Where did you find a concave chest? How could you?
Oh, look, you see it.
Oh, you see it, okay.
It was just concave, and you could be concerned about it. And I think they were, the midwife was looking, we were looking, but nothing untoward came of it. So we never worried about it, but she's had issues. She's the one whose hemoglobin dropped to 1 and so on. Yeah. Oh, so just a quick update on that woman with the low hemoglobin. Lo and behold, we did her hemoglobin again and it was 10.6.
So it's just because the person who did her blood.
I guess there was doing a false reading in an error in the first place. It was just having me awake for nights and then I got the 10.6. And
If it was really that low, the
See,
punches-
I bit my tongue that day. I was going to say
Okay,
4.6. Are you serious? That test was right?
Danishta was sure. I don't know. Oh, the other thing wasn't just Danishta. You know, whatever they call them, Danishta can say it again. But the Panchayat nurses went in and they must have, somebody ran another blood test on her. Not, it didn't come from me. Somebody else must have done it. And they also said she was low.
Yeah, but they didn't say she was alarmingly low.
Danishta might correct, but I'm not sure. She was,
So I
I
feel
heard
like
the
she
story
was that
first.
low, it would suggest.
Oh, they
adjustment
wouldn't have
should be
approved
like-
of that. Oh, yeah.
She probably wouldn't even make it there, but she'd be so weak.
Correct, and that's the thing that she did not tick any of the boxes, although she did look a little pale, but she's a dark-skinned woman, and that's part of an issue with dark-skinned
You
people.
can tell.
It's hard to tell. You
You
kind
can
of,
tell I'm blushing. You can tell
You
I'm
can't-
jumping.
you're lying, aren't you? You're lying. Exactly, you have to kind of check the under skin tone, the eyes especially, yeah, eyes you check and look.
Palm of tail.
Palms, exactly, all these things, the tongue, the mouth, yeah, things like this. We're looking at the blood circulation. So indeed, she's just been tough and strong. The only thing that triggered me visually was just that she looked a little yellow. She does have apparently some liver issues within her life. She said she's been jaundiced 3 times before, even as a child. You know, she's from Bangladesh. She's come over here. So these are issues too when you're
Okay, so
dealing
she
with.
does have that issue. That explains
Correct,
that
yes.
he-
Could be. She always overcame. She always came out of it, right? So again, sometimes people,
Ah.
yeah, their bodies learn to adjust. Yeah. So
I think starting dandelion root mother tincture would be a good idea for her right now. And drinking some celery juice, amla juice, stuff like that helps liver.
yeah, perfect. Yeah. So, well, but I feel a whole lot better now about the birth. I was really worried. I sure as hell didn't want to. You get attached, you get it. This is the issue. You get attached to their births and you want them. Here's this woman.
Like you're rooting for them.
Then this woman, especially now, you get so many struggling births. She's just such a strong woman, and she's had some issues coming across the border, Bangladeshi, the whole deal. Her mother's here now. Walter just squats and pushes out her babies. I want her to have a home birth.
I wanted
Yeah.
to work for her so bad. We had
Yeah.
so much fun with her when we went. I'll show you some fun photos.
I heard it was your birthday.
Did show you the photos?
Not yet, but I heard all about it and I was so happy.
Fun, but the husband was concerned about. He brought up some really fatherly concern. He did acknowledge she's a strong woman. She's doing great, but they're worried about Plan B. If
Plan
they
B.
have to transfer, he he asked if there is any contact of anybody in the hospital that we can give a phone number to him so he can call, give them a little extra money and be friends with them.
No,
So
we
that
already
in
have
case
that.
of emergency, he can take his wife there and they can treat her normal.
Well, we do have that already, that arrangement in place. I think Denisha did
I
explain
told
it.
him to talk to you, whatever you have, you would share.
Yeah.
Yeah, she said the mother is concerned, although she knows or she's confident things will go good, but what if,
Yeah, the plan
the
B.
what if? I was like, that's not a weird thing to, imagine.
Yeah.
So people do have plan B and it's okay to
Yeah,
not
we have
do
a
that
plan B.
Exactly, I told her, we all.
Yeah,
plan
we've
for
used
plan
it.
B.
We use plan B.
And yeah, I assured him that he can talk to you and things will go well. She's strong, she's doing good. It's her first birth, she's still young, she's picking all the boxes, she'll do great. And yeah, they were just concerned and they didn't know. He was hoping I had a number somewhere. It's like, did you talk to her about all this stuff and you're just trying to get a side
Yeah, it's an interesting stuff.
some extra information.
I think I need to get my own ambulance
When did she do?
now. She's due on the 15th. Today's the 23rd,
Yeah.
so she's a week over, which I kind of thought she might go 2 weeks over. Actually.
Yeah.
So
Yeah, I told him if you were to go now, they would tell you to cut your woman now. It's like trying to be friends with the hospital.
and we have Neela Chella as well.
Yeah, okay.
So she's due on the 5th. She might go early. So we'll see. See what happens.
You lecture on the 5th. I mean, if
5th of February.
you lecture,
Yeah.
Akaranga. For real?
No, not Antaranga, Neela Chella.
Nilacha is actually a name of a mother.
Yeah, it's her
Oh,
mother.
I
mean, it's the
you
mother.
said that I'm actually talking about
Antaranga, no, she's
lives
due.
in Nilacha.
Oh,
I always
got it,
thought
got it.
about- okay,
Got it,
that
okay.
makes sense.
Now it makes sense too.
Okay.
Confusion. Okay, thank you very much. If there's no questions, or anything to add to that. I will use that thing as an assignment when I sent out, and I'll send it out again. The made up exams that I was gonna get you to make the exams. So I'm turning it to an assignment because I can't trust you guys to make an exam. So I will do that. The other thing is very important. So Denishta is going to do things on what we're gonna do our clinics on Wednesdays and Fridays. I want on Wednesdays and Fridays, in addition to this, as we've said, there's practicals. Denishta will start organizing and we will start doing these practicals on Wednesday. I want to start with, well, we'll either start with the oxygen or we'll start with the, what's the other thing? Oxygen or IVs. What do we have to do, Denishta? Do we have to set anything up for anybody? I might get another home visit done. Denishta's pretending.
Denishta!
No, she's hiding. She's in the kitchen cooking. Damn. Okay, but that's what's happening. We're gonna do this. So please, students, show up and practice.
Wait, I missed that. When are we showing up?
Wednesday and Friday. So
Wednesday.
tomorrow and Friday.
Based on newborn.
Well, I have to figure out who I'm seeing. So whoever is assigned to whoever.
Okay.
New one is Lakshmi Priya. That's on Friday. Neelichala is tomorrow and Savita. So you're Savita. You're with Neelichala.
Okay, I haven't met her yet, but.
Okay, so come, and Colleen is coming too at 10 o'clock. Neelichala is 10 o'clock, Savita is 12 o'clock, and we will do some practicals after that. That's this Wednesday.
Okay, wait. 10 o'clock on Wednesday.
12 o'clock for you.
12 o'clock for me.
Yeah.
On Wednesday.
Wednesday.
Got it. Write it down.
Okay. All right, guys, thank you so much.
Okay.
And let me know. Any updates to any stories? Kenya? Okay,
He has a photo. Just go through them.
oh, look at her.
Go
Oh,
up.
is that her place?
No, go up, I think it will.
No, sorry.
Okay. Yeah, that's her place. She had me pop this random balloon she had on the stage. My birthday was so fun.
Oh, glad that happened.
Yeah, we got pregnant. Oh, look, did you see the other one?
Yeah, I went, there's 4.
Did you see our belly?
Oh, no, I don't keep going, you took a bit.
You see Denisha's pregnant belly?
Denise does.
Yeah, the last one.
Yeah, you're one, right?
Oh. You do look pregnant, Denise. The one in the middle is pregnant. Okay, ladies, thank you so much. And we'll do this again Thursday. I might do a video of the practical tomorrow. So yeah, you can either see it as the video or watch live. Okay, thank you, everybody. Haribo.
Haribo.